Hello, hello. Welcome back. Welcome back to the audio series of the CT Tech Cheat Code, where you're going to dominate your CT training. Now, in this episode, we're going to talk about handling mistakes like a professional. So, we know in CT, we typically, we make mistakes. You will screw up. The difference is on how you respond to that and what comes after that. So I'm going to give you some talking points that I'm going to do and give you some pointers and some guidance on how to navigate this. So some common CT mistakes could be bad patient centering, positioning, IV infiltrates, missed IVs, scanning errors. It could be scanning the wrong body part, scanning the wrong patient, missing an exam on a patient. All those things are common CT mistakes. Listen, there is such a quadruple amount of increase of exams that we're doing nowadays. Doctors are being taught that to get the imaging and labs before they do anything. Okay. So it is very high demanding and very high impact where, they're ordering, 25 exams in 20 minutes time. Okay. So it's a lot. And it opens up the potential to, certainly make mistakes, especially if you have traumas and you have to fit in a stroke, if you have to do this, if you have to do that. And it could really just be daunting. Okay. So those are some of the common mistakes that we see. And what I always encourage everybody is, don't rush through your exams. Make sure that you give yourself adequate enough time so you can check images, make sure you check your labs, check, allergies, check orders, make sure your patient's comfortable, making sure that, you got nice quality images, because that is important. Okay. It's not about speed. It's about quality. Okay. Not quantity over quality. Okay. So you want quality over quantity. That's the most important thing, okay? Because you have to remember CT is not a fucking conveyor belt, even though they like to see it like that. That's not how that goes, because there could be potential harm that can be caused to the patient. So the one thing is to own it without falling apart. We all make mistakes, guys. It is completely human. We're all human. We're people. It's okay. It's even better when you're honest about it, you own it, and you take responsibility for it. I can't tell you how many texts I've seen that do not own up to their mistakes and blame it on the machine, blame it on the patient. No. If anything, if you're going to blame anybody, blame yourself. Say, okay, what went wrong here? How can I improve this? Because that is part of growth. It's not the machine fail. Now, I'm not saying that, they can't be mechanical errors on CT machines, because absolutely they can. But 90% of it is usually tech error. So just own up your mistake, take responsibility, and then just make sure it doesn't happen again. So when to report, when to fix, and when to ask. So if you make a mistake, ask, okay, what happened here? What could I have done better? And then when to fix it, bring the patient back for more images, get another IV started, making sure you rescout them, whatever the case is. And then when to report it. Of course, infiltrations, you have to report those. Okay. So because they have to keep track of those, because those can really cause patient harm. Okay. So making sure you do that. Or if you do like a wrong exam, get in touch with the doctors and this and that. Making sure that you alert the appropriate parties for that, because those are super important, just so you don't get yourself in trouble. And documenting as well, documenting in the charts and making sure that, hey, this IV infiltrated, this is what happened. And because radiologists, and now if you use Epic, they're able to see study notes and things like that if anything happened to the patient. And then rebuilding trust and learning from failure. So sometimes the patients will be like, you did this twice and you obviously can't get this right. And they start to lose trust. Okay. So just what I always do is I say, I'm very sorry. I'm just going to get another technologist to start your IV, or get a nurse to start your IV. Let's say if you attempt it twice, the patient does kind of lose the confidence. You lose your confidence and you're like, okay. So you just learn from that experience, because guess what? Not all of us can get every IV. It's not humanly possible. Okay. Some patients are harder than others. Some patients don't have veins. So it's okay to ask for help. Okay. And then if you really screw up on an exam, how can you learn from that failure? Because learning from failure is growth. Okay. So I would want to fail 1,000 times before I say, oh, well, and blame somebody else. Okay. I would rather fail than not do it at all. Okay. So learning from failure is a very important step into growth. And that is how you're going to handle all your mistakes and maybe some mini screw ups as a professional, because this is a profession that we do and we are here to serve our patients. So those are the talking points, and that is it that I have for this episode. Hopefully these are good points that you can take away and, think about it while you're training. So in episode 8, we are going to talk about speed, efficiency, and still doing it right, because I know I've talked about that in a prior episode. So thank you so much for listening and joining me on this episode, and I will catch you in the next episode.